The volume of scientific literature is rapidly increasing. There are now over 1 million articles indexed on PubMed each year. Despite significant investment into drug development and publication processes, target audiences may miss key articles because they are overwhelmed with the sheer volume of the scientific literature. Typical content consumption patterns for journal articles are highest when they are first released, and article views decline rapidly after the first 30 to 60 days. So, if a key reader doesn't see an article in the first month or two after it is published, they may never read it, even though the information may still be very relevant to them. By adding publication amplifiers, you can ensure additional readership and discoverability of existing journal articles by directing readers to relevant articles that they may have missed. The first step in the process of publication amplification is to understand your audience. You must first identify high-priority publications or key articles for which the audience awareness is critical. Then discover and evaluate the sources of information and preferences for learning within this audience. You can discover these details through an information sources audit. An information sources audit uses syndicated research and surveys to identify where audiences are going for their clinical information. The responses to the data are clustered and measured based on reach, frequency, and importance. These are key factors needed to identify the ideal avenue and partnership for disseminating key article data to your audience. Specialists in one disease state may rely on or visit very different sources than providers in another therapeutic area.
In addition to more traditional publication amplifiers, such as enhanced content or plain language summaries, another route to publication extension is through third-party partnerships. These partners fall into a few buckets. First, healthcare providers use closed physician networks, such as Doximity and Sermo, to get news and interact with colleagues. Within these platforms, you can create summary videos highlighting key points of an article, then share the video in news feeds of your identified physicians. Or create posts summarizing key article points with links to the full articles. Publishers such as Springer Nature and publisher network partner TrendND provide opportunities to align your key articles within trusted journal websites as suggested content based on topic, specialty, and geography parameters. Article portals such as QXMD and ResearchGate are sources of information for many specialties looking for newly released article content. By partnering with these portals, you can amplify your publications within platforms already being used for article discovery. The last piece of publication amplification is measurement, which we believe goes beyond just tactical metrics. To truly evaluate success, we also measure attitudinal metrics such as data understanding, perception, and retention. As our audiences and the ways they consume content change, our work needs to evolve as well. Take advantage of the growing number of channels available for data dissemination to break through the noise more effectively.